Remember to comment below if you want more videos about one specific topic, and do single quote forget to subscribe to the channel.
Signs that you need to see your doctor. If you suspect you or a loved one might be showing signs of dementia, your first step should be to see your doctor. It is only through various tests that an actual diagnosis can be made. Common signs of dementia. These are all common signs of dementia that indicate that it is time to visit your doctor. Subtle short-term memory changes, such as not remembering the name of a person you know well, or a common object. Difficulty following conversations. Changes in mood or personality, such as being very quiet, or suddenly aggressive and loud. Listlessness. A lack of interest in things they normally do. Trouble completing tasks you would usually do, such as at work or around the house. Confusion. Lack of awareness of what day or time it is, where you are and how you got there. Difficulty following movies or TV shows. Getting lost more often, even in familiar areas. Not all memory loss is dementia. The good news is that not all memory loss is dementia, and not all dementia is Alzheimer's. In many cases, there can be simple lifestyle reasons as to why your memory isn't as sharp as it used to be. 3 main causes are stress, lack of quality sleep, and certain medications. Your doctor can help you with all of these. There are many effective stress management techniques. Your doctor can review your sleep habits to make sure your nightly routine is a good stepping stone to a full night of high-quality sleep. Certain medications have known side effect of impairing memory. Your doctor can usually offer alternatives that won't harm your memory, and monitor you to see if your symptoms improve or even disappear. Early detection is key. As with most medical conditions, early detection can often be the key to a better outcome, rather than having waited to see a doctor until things have progressed too far. Your primary care doctor will be your first stop. They will run blood tests and urinalysis to detect any underlying health issue that might be triggering memory issues. For example, high blood pressure, diabetes and thyroid issues can all lead to memory problems. If they discover any medical condition, it can be treated and you can monitor whether or not memory returns. Being referred to specialists depending on what the first set of tests uncovers. A person suffering from memory loss will usually either be treated, or referred to one or more specialists. Each of these specialists can help decide if it is dementia, or some other brain health issue. A neurologist will help determine whether the structure of the brain is normal, and the degree of cognitive function. A psychiatrist can help determine whether or not the behavioral changes which might have manifested are a sign of dementia, or of a mood disorder. A geriatrician specializes in the medical conditions suffered by older people. They can help formulate a treatment plan depending on whether or not the person is suffering from cognitive impairment, dementia or Alzheimer's. Diagnostic tests. Each doctor will administer verbal tests and tests on paper to the patient. These are an established method to help diagnose dementia. And if dementia is present, the tests will also determine the rate of decline, such as in Alzheimer's. They might also order kinetic scans, MRIs and other imaging tests to determine if the structure of the brain has changed in any way, such as due to a tumor or a stroke. Again, depending on what is found, the doctor will determine a course of treatment or other plan of action to deal with the memory loss.
I know that you like it like that. I wear designer, check the name on the tag. White fox fur on my jacket. Excuse me, that's